Good morning, everyone. Good morning, classmate. Good morning, ma'am. My name is Stephanie May Sulan from BA Psychology 1. My topic for today is about gender dysphoria. Overview. Gender dysphoria is a term that describes a sense of unease that a person may have because of mismatch between their biological sex and their gender identity. This sense of unease or dissatisfaction may be so intense it can lead to depression and anxiety and had a harmful impact on daily life. So gender dysphoria is you are not satisfied or you are dissatisfied about your gender identity. So for example, if you are a boy with gender dysphoria, you have a strong desire to be a girl that can lead you to depression and affect other important areas of your life. Diagnostic criteria: gender dysphoria in children. A marked incongruence between one's expressed gender and assigned gender of at least 6 months duration, as manifest by at least 6 of the following, one of which must be criterion A. So before you diagnose children with gender dysphoria, dapat maka-exhibit siya sa symptoms, at least 6 symptoms within 6 months. So number 1, a strong desire to be one of the other gender and insistence that one is the other gender or some alternative gender different from one's assigned gender. So in boys, mas gusto nila maging babae. So nag-desire sila nga maging babae. Same with girls, nag-insist gid sila nga they are a boy or she is a boy. Number 2, in boys assigned gender, a strong preference for cross-dressing or simulating female attire. So in boys naman, nag-wear na sila sang dress or something na a girl outfit. So in girl naman is nag-wear man sila sang boys clothes, like for example nag-wear sang t-shirt, boys t-shirt or pants na pang boys. Number 3, a strong preference for cross-gender roles in believe play or fantasy play. So here's a number 3, gusto gina-fantasize niya na gusto yung maging nanay. In boys, they are fantasizing na maging mommy sila someday. Tapos sa girls naman, they are fantasizing na gusto nila maging daddy someday or magbata nga sila. Ang lalaki daw sila ang tatay, like for example. So number 4, a strong preference for the toys, games, or activities stereotypically used or engaged in by the other gender. So sa girls, they are engaged in boys activities or boys games. So ang ginahimo nila usually is the mga pang boys nga mga activities. So sa boys naman, ginahimo nila itong mga pang girls nga mga games or activities. Like for example, they are playing Barbie doll or something na pang girls talaga. So number 5, a strong preference for playmates of the other. So number 6, in boys assigned gender, a strong rejection of typically masculine toys, games, and activities in a strong avoidance of rough and tumble play. So sa boys, which is gina-avoid nila itong mga pang boys nga games or activities. So hindi nila gusto ang mga daw boys nga mga games, like for example basketball or anything na for boys only. So in girls naman, avoid nila itong mga feminine toys like Barbie and like ng laro-laruan or luto-lutuan for girls. So gina-avoid nila, so gina-reject kay mas gusto nila itong mga pang boys nga activity. So number 7, a strong dislike of one's sexual anatomy. So like for example, hambalan mo sila nga like for example in boys, you compliment him as boy. So nagano siya, nag-stress siya or something. Hindi niya gusto na i-compliment mo siya as boy. Like for example, hambalan mo siya, gwapo ka. So hindi niya they dislike. So kung hambalan mo siya, gwapo ka, kina-compliment mo siya as a girl, so number 8, a strong desire for the primary and or secondary sex characteristics that match one's experienced gender. So sa number 8, the way siya mag-act. For example, ang boy is the way siya mag-act is like girls talaga. Girls ang act niya, the way siya manamit, which is girls characteristic. Criterion B, the condition is associated with clinically significant distress or impairment in social, school, or other important areas of functioning. So sabi naman is naka-affect or it is affect their social life or scholastic and other important areas of their life, because they are, if you have gender dysphoria or gay or trans woman, so you are prone in bullying. Specify if with a disorder of sex development. So specifier niya is if they have sex development. For example is congenital adrenogenital disorder such as congenital adrenal hyperplasia or androgen insensitivity syndrome. And sa coding note, code the disorder of sex development as well as gender dysphoria. So gender dysphoria in adolescents and adult. Letter A, a marked incongruence between one's experience expressed gender and assigned gender of at least 6 months duration as manifest by at least 2 of the following. So before you diagnose adolescents or adults in gender dysphoria, dapat within 6 months and ma-manifest niya ang at least ma-meet niya ang at least 2 criteria. So number 1, a marked incongruence between one's experience expressed gender and primary or secondary characteristics, or in young adolescents that display secondary sex characteristic. So mas gina-express niya ang like for example, boy siya, so mas gina-express niya or gina-exhibit niya ang mga girls niya characteristic. So number 2, a strong desire to be rid of one's primary or secondary sex characteristic because of a marked incongruence with one's experience expressed gender, or in young adults a desire to prevent the development of anticipated secondary sex characteristics. So na-stress siya or hindi niya gusto ang iyang gender identity, so they want to change them or change their gender identity. Number 3, a strong desire for the primary or secondary sex characteristics of the other gender. So mas gusto itong mga babae mas gusto yung i-act ang mga pag-uugali ng mga babae, or sa babae, they want to act like a boy. Number 4, a strong desire to be of other gender or some alternative gender different from one's assigned gender. So, mas gusto niya in boys, mas gusto niya maging babae gid siya. And in girls, gusto niya talaga na maging lalaki siya. So, number 5, a strong desire to be treated as the other gender or some alternate gender different from one's assigned gender. So, mas gusto nila, for boys, mas gusto nila nga i-treat mo sila or you compliment them as girl, na pang compliment sa girl. Like for example, hambalan mo siya gwapa, so yes, they want to treat them like tumawa sa prefer nila nga gender. Number 6, a strong conviction that one has the typical feelings and reaction of other gender or some alternative gender different ones assigned gender. So same sa example sa number 4. So nag-act sila like a girl, or sa girl naman nag-act siya like boy. So strong feelings or actions. Ang reaction is girl talaga usually. Then sa girl naman, which is mag-reaction is, or reaction is like a boy. Criterion B, the condition is associated with clinically significant distortion in social, occupational, or important areas of functioning. So, sa criterion B, nag-affect ang disorder or distress nila in their social or occupational or other important areas of their life. So, nag-affect nito ang pagkakaroon ng disorder. Specify if with a disorder of sex development. Yes, same sa gender diagnostic criteria or specifier sa children. So, congenital adrenogenital disorder such as congenital adrenal hyper or androgen insensitivity syndrome. So, coding note, the disorder of sex development as well as gender dysphoria. Specify if post-transition, the individual has transitioned to full-time living in the desired gender with or without legalization of gender change, and undergone or is preparing to have at least one cross-sex medical procedure or treatment regimen, namely regular cross-sex hormone or treatment, gender reassignment surgery confirming the desired gender, example, penectomy, vaginoplasty in natal male, mastectomy, or phalloplasty in natal female. So, the specifier is dapat in boys, so naka-transform siya in girls in all aspect. Tapos in girls naman is nag-transform siya as a boy in all aspects ng ilang life. Then sa boy, so they undergone at least one treatment, so nagapa-treatment or nagapa-surgery, like for example, or nagiinom sa lasang bulong for the cross-sex medical procedure or treatment. Differential diagnosis, non-conformity to gender roles. Gender dysphoria should be distinguished from just simple non-conformity to stereotypical gender role behavior by the strong desire to be of other gender than the assigned one, and by the extent and the pervasiveness of gender variant activities and interests. The diagnosis is not meant to merely describe non-conformity to stereotypical gender role behavior. Example, tomboyism in girls girl-boy behavior in boys, occasionally cross-dressing in adult men, give the increased openness of atypical gender expression by individuals across the entire range of transgender spectrum. It is important that the clinical diagnosis be limited to those in whose distress and impairment meet the specific criteria. So the difference of nonconformity to gender roles in gender dysphoria is sa nonconformity, which is wala sila sang distress or impairment na they are usually act like a boy even though, or like they usually act for their own gender even though gusto nila is maging other identity. Like unlike dere sa gender dysphoria is ginalegal niya gid nga, or he or she have a strong desire to be other gender, or naga cross sex na siya, naga cross dressing, naga in boys naga-wear na siya sang naga-wear na siya sang pang girls nga attire, and in girls naga-wear na siya sang mga boys nga outfit. So, second is transvestic disorder. Transvestic disorder occurs in heterosexual or bisexual adolescents and adult males, rarely in females. For whom cross-dressing behavior generates sexual excitement and causes distress and impairment without drawing their primary. With transvestic disorder, who also has clinically significant gender dysphoria, can be given both diagnosis. In many cases of late onset gender is genipelic natal males. Transvestic behavior with sexual excitement is a precursor. So the difference of transvestic disorder is which is exhibit by heterosexual or bisexual, and it has sexual or behavior with sexual excitement. Sa gender dysphoria is cross-dressing and strong desire to be to other gender, to be in other gender. Body dysmorphic disorder. An individual with body dysmorphic disorder focuses on alteration or removal of a specific body part because it is perceived as abnormaliform, not because it represents a repudiated assigned gender. When an individual's presentation needs criteria for both gender dysphoria and body dysmorphic disorder, both diagnoses can be given. Individuals wishing to have healthy limb amputated them by somebody integrity identity disorder because it makes them feel more complete. Users do not wish to change gender but are desired to live as an amputee or disabled person. So, body dysmorphic is nagapatanggal sila sa ilang lawas or any body parts nagapa-surgery sila. Unlike dere sa gender dysphoria is naga-change sila sang ilang gender identity. In body dysmorphic is biskan hindi siya mag-change ang gender, pero hindi wala siya balak mag-change ang gender, pero may nagapa-surgery siya or something, ginatanggal siya sa iyang lawas, and desire niya to live as disabled person. Schizophrenia and other psychotic disorders. In schizophrenia, there may rarely be delusions of belonging to some other gender. In the absence of psychotic symptoms, insistence by an individual with gender dysphoria that he or she is of some other gender is not considered as delusion. Schizophrenia or other psychotic disorders and gender dysphoria may co-occur. So, may symptoms siya sa schizophrenia, which is the delusion. So if a person have a have gender dysphoria and schizophrenia, so the gender dysphoria should not be the diagnosis kay ara ang presence ng schizophrenia or delusions. Pero if he or she have a strong desire to other gender identity in absence of schizophrenia or delusions, so the diagnosis is gender dysphoria. Other clinical presentation. Some individuals with an emasculine desire who develop an alternative non-male, non-female gender identity do have a presentation that meets criteria for gender dysphoria. However, some males seek castration or penectomy for aesthetic reason or to remove psychological effects of androgens without changing male identity. In this case, the criteria for gender dysphoria are not met. So sa other clinical presentations, so wala man sila balak mag-change sang ilang male identity or ilang gender identity, pero nag-seek sila sang castration like penectomy or nagapa-surgery sila or something, nagapa-treatment for any psychological or for aesthetic reasons. Comorbidity. Clinically referred children with gender show elevated levels of emotional and behavioral problems, most commonly anxiety, disruptive impulse control, and depressive disorder. In pubertal children, increasing age is associated with having more behavioral emotional problems. This is related to increasing non-acceptance of gender-variant behavior, often leads to peer ostracism, which may lead to more behavioral problems. So usually sa comorbid sa gender dysphoria is children who have problems with their emotion and behavior. Other specified gender dysphoria. These categories apply to presentation in which symptoms characteristic of gender dysphoria that cause clinically significant distress or impairment in social, occupational, or in her important areas of functioning predominate but do not meet the full criteria for gender dysphoria. The other specified gender dysphoria category is used in situations in which the clinician chooses to communicate the specific reason that the presentation does not meet the criteria for gender dysphoria. This is done by recording other specified gender dysphoria, followed by the specific reason, some brief gender dysphoria. So, there is other specified gender dysphoria is she or he have symptoms na exhibit, pero this is hindi siya ma-specified or hindi niya na-meet ang all criteria of the gender dysphoria. So, mabutang siya sa specified gender dysphoria. Other specified. An example of presentation that can be specified using the other specified designation is the following. The current disturbance meets symptoms criteria for gender dysphoria, but the duration is less than 0. So this is one of the reasons is the time or the months. So maybe nakaramdam siya ng symptoms but less than 6 months. Unspecified gender dysphoria. These categories applies to presentation in which symptoms characteristic of gender dysphoria that can cause clinically significant distress or impairment in social, occupational, or other important areas of function predominate but do not meet the full criteria for gender dysphoria. The unspecified gender dysphoria category is used in situations in which the clinician chooses not to specify the reason that the criteria are not met for gender dysphoria and includes presentation in which there is insufficient information to make more specific diagnosis. So, sa unspecified gender dysphoria, na-meet niya man ang criteria pero hindi matukoy ang symptoms because of some specific reasons or some reasons. So, etiology or causes temperatural for individuals with gender dysphoria without a disorder sex development. A typical gender behavior among individuals with early onset gender dysphoria develops in early preschool age, and it is possible that high degree or atypically makes the development of gender dysphoria and its persistence into adolescence and adulthood more likely. So, sa temperature, maybe na-influensyahan siya or may mga nakita siya sa mga around sa iyang palibot, which is ginagaya niya. So, environment. Among individuals with gender dysphoria without a disorder or sex development, males with gender dysphoria in both childhood and adolescence more commonly have older brothers than do males without the condition. Additional predisposing factors under consideration, especially in individuals with late onset gender dysphoria. Adolescence-adulthood include habitual fetishistic transvestism developing into autogenophilia, example sexual arousal associated with the thought or image of oneself as a woman, and other forms more general social, psychological, or developmental problems. Genetic and physiological. For individuals with gender dysphoria without a disorder or sex development, some genetic contribution is suggested by evidence for weak familiarity of transsexualism among non-twin siblings, increased concordance for transsexualism in monozygotic same-sex twins, and some degree of heritability of gender dysphoria. So, sa genetic is may ara silang history or family na same with this disorder. May ara sang amo sininga disorder. Treatment, hormone therapy for adults. The aim of hormone therapy is to make you more comfortable with yourself, both in terms of physical appearance and how you feel. Others include voice therapy and physiological support. Behavioral health treatment. This treatment aims to improve your psychological well-being, quality of life, and self-fulfillment. Behavioral therapy isn't intended to alter your gender identity. Instead, therapy can help you explore gender concerns and find ways to lessen gender dysphoria. The goal of behavioral health treatment is to help you feel comfortable with how you express your gender identity, enabling success in relationships, education. Work therapy can also address any other mental health concerns. Therapy might include individual, couples, family, and group counseling to help you explore and integrate your gender identity, accept yourself, address the mental and emotional impacts of the stress that results from experiencing prejudice and discrimination because of your gender identity. Minority stress. Build a supporting work. Develop a plan to address social and legal issues related to your transition and coming out to loved ones, friends, colleagues, and other close contacts. Become comfortable expressing your gender identity. Explore healthy sexuality in the context of gender transition. Make decisions about your medical treatment options to increase your well-being and quality of life. Therapy might be helpful during many stages of your life. A behavioral health evaluation may not be required before receiving hormonal and surgical treatment of gender dysphoria, but it can play an important role when making decisions about treatment options. This evaluation might assess. Thank you for listening. God bless you all.